Education, health, and water, indispensable services for a functioning society. But in many countries, they are failing, with dire consequences. Failure in education costs children their future. Failure in water and health can cost people their lives. There are many factors that hamper these basic services. Lack of funds, resources, and know-how are commonly blamed. But it is corruption, mismanagement, and poor governance that often deal a deadly blow. This film looks at the work of Transparency International in the water, health, and education sectors across Africa.
Corruption ordinarily happens behind the scenes, so it's not as dramatic as a civil war or civil strife, but it can be as damaging, if not more damaging than civil strife.
Here in South Africa, this building looks like a simple shack, but it's actually a school. The children of Kunjuluwe community are educated here. The facilities illustrate one kind of mismanagement plaguing basic services like education.
Teachers cannot communicate with us clearly because now the shacks are very noisy.
It's so like suffocating and stuff, so it's not good for our health.
Everyone agrees that the learning environment here hampers the pupils' education. Teachers, parents, and even government officials all want to build new classrooms for them. And they did, almost. These are what should have been new buildings for the pupils of Kunjuluwe. But the decision to build here was made without full consultation. A flawed process pushed through construction on this sandy patch of land.
Before hona le site engwe ne ileng ya suptjwa gore sekolo se tlo awa teng. All of a sudden, without our concern as a school, ba se ba tloa bat ba department sa batla mo batlo a ba sa rapolal. So now a re thabele bona o etsalang ba ntšhelete e be ithusitse.
Soon after construction began, walls started to crack and collapse. The ground wasn't stable enough to support the brick structures. Finally, the site was abandoned. The money was gone. The result is that the pupils of Kunjuluwe still learn in these run-down facilities. Transparency International, a non-profit that leads the fight against corruption, encountered many such instances where misuse of the little resources available led to a deterioration in public services.
We clearly have a strong case to advocate stronger vigilance, governance vigilance, in order to make sure that resources which are scarce, which are available, are used to maximize service output.
Transparency International observed that it's not just straightforward corruption, the classic cash-filled envelopes that hamper basic services. There are related factors at work: poor governance and mismanagement. Over the past few years, the advocacy organization has undertaken a major program to get to the heart of the problem. It aimed to find precisely what impact corruption and mismanagement have had on health, education, and water, and how it is possible to turn the situation around. The program is called Transparency and Integrity in Service Delivery in Africa, or TISDA for short.
Corruption or any malpractices, they do deprive the people on access to health care, and this can lead to wrong treatments being administered. And worse still, the poor are normally affected quite more.
The governance gaps that exist in the entire chain that inhibit or that make it difficult for everybody to access water. So you find that water is available, but it's not accessible for everybody.
When basic services don't deliver, poor communities are normally hit hardest. So Transparency International's work puts a special focus on poor communities in Africa. It investigated the state of affairs in 7 countries, focusing on one service in each country. The program is part of Transparency International's broader drive to investigate the nexus between poverty and corruption and to work more actively at the grassroots level.
Donc, question pour nous de voir là où le risque est logé. Est-ce que le problème se trouve au niveau du ministère? Est-ce que le problème se trouve au niveau du département? Est-ce que le problème se trouve au niveau de la région ou alors au niveau de l'école?
Ce qu'on apprend dans la corruption, c'est essentiellement ça, y compris que le système global, l'État, est lui-même affecté.
In Uganda, Transparency International's chapter has focused on the health sector. In this small town, Sarah Nakakande is about to open her shop. But a severe migraine keeps her from working. She has to take a painkiller. Sarah has traveled to many doctors and hospitals, but Uganda's public health service is understaffed and underfunded. So far, she has failed to even get a proper examination. One factor significantly amplifies the general shortage: absenteeism among health workers.
Most of the health workers, they don't report on duty on time, and secondly, there are others who even don't attend on duty at all. They take like 2 or 3 days without reporting to the health facility, yet that is what they are employed to do.
So you can go to the health facility, say at 10, and the health worker is not there. And then you find a line of patients there.
Sarah has run out of medicine and is hoping to pick up some more. Her only option is the local health center, a 30-minute walk away. When she arrives, the hospital is packed with patients. She'll be waiting for hours.
I met there so many sick people, and I found there the one doctor. That is the problem.
The one doctor's name is Godfrey Sewandi. He does his best to help Sarah and the other patients, but he is simply overwhelmed by the task. Making matters worse, 2 members of his staff haven't shown up for work for 2 days now.
Some 2 people were expected yesterday. Possibly they are returning today. They were to be on job yesterday. Ideally, we are supposed to be around 19 staff at this level, according to the government policy, but we are 6.
The workload for employees in many basic services is high, while salaries remain low. So Transparency International found that in many countries, service workers look for alternative incomes simply because they are frustrated.
We say it's very small.
They are overworked, they are underpaid, and they don't have facilities. Even when they want to serve, they don't have the facilities that they need to serve the people.
So health workers often set up a second business, a few as traditional healers like this doctor, or more commonly in a private clinic. And when they are on the job, some actively ignore their responsibilities. And that is another reason why basic services fail, a vicious circle. Staff are frustrated by the lack of resources and abandon their duties. This is sometimes called quiet corruption, and it seriously diminishes the quality of service provision.
The effects is death. When someone is poor, cannot afford to go to the private sector, they go to the government sector, they can't get the service they need, they go home and die.
Transparency International advocates an environment that rewards worker commitment with reliable public budgets and a more active role for users, who are the real experts. At the moment, users simply turn away from the official services and look for alternatives. but by doing so, they inadvertently contribute to the deterioration of the services they so desperately need. The difficult conditions in Mombasa's old town are typical. Saiton Hussein lives here. She uses well water to clean her dishes. There is no running water.
Nafikiri sisemi kama ufisadi, lakini naona hizo mambo ya zamani yote yamekatizwa. Paipu hazitengezwi, ni mbovu, hazichunguzwi zikaangalia kuna nini.
In Ghana, Kenya, and Senegal, Transparency International has focused on water services. Because the pipe systems rarely work, people have taken matters into their own hands. Some have drilled wells, like this one, where Saiton buys her water. Others illegally tap the water providers' pipe systems, leading to a drop in water pressure.
People consume the water without paying at all via illegal connections. Now, we lose about 40% of the water we produce through some of these acts.
Illegal tapping also affects the water supply in other ways. With less water coming out of the tap, informal water sellers, like this one in Ghana, come under strain. The people who use the water services often behave irresponsibly and sometimes aggressively, up to the point of vandalism. In Ghana, just as much as in Kenya and Senegal, paying bribes and refusing to pay water bills are common in many communities. Ultimately, the entire system is undermined through such behavior. But in talking to all sides, Transparency International found that everyone has an interest in a functioning service. Government officials want healthy communities, service providers want to make a profit, and users want reliable services. And this is where regulators play a crucial role, because it is their job to make sure that the rules are enforced and that responsibilities are clear.
Regulators need to have the teeth and the autonomy to be able to punish or hold accountable providers. They need to know what the rules of the game are. They all have to be properly defined.
Improving service provision is not just a matter of fighting corruption. It is also about changing how services are run, and that can't be achieved by any group alone. So in addition to participation, transparency, and accountability, one approach is critical.
Dialogue. The dialogue and consultation among the various stakeholders holds the key to identifying these issues as documented and coming up with solutions.
If we are all responsible in managing our duties, our schedules, what is expected of us, then we should reach a very good percentage in efficiency levels.
Improving service delivery requires a collective action, and the TISDA project has actually adopted this participatory approach where we have been working closely with a wider stakeholder group.
In Mombasa, two researchers from Transparency International Kenya visit Saiton Hussein. Their work in basic service delivery goes beyond analysis. With the personal connections made and knowledge gained through the research phase, they now help promote dialogue, transparency in decision-making, and the strengthening of checks and balances at all levels in basic service provision.
TISDA will provide a platform for these particular stakeholders where they will be able to have a constructive engagement through dialogue.
C'est de faire émerger des informations sur la corruption, de rechercher des consensus entre les acteurs et de lancer une dynamique de synergie pour transformer la situation.
It does not suffice only, to be able to sit under a baraza or to sit in a public meeting, and yell at each other and throw questions back, you know, and people getting actually emotional. It's actually really important that, you know, one particular community with a service provider, in the case, you know, the water service provider, come together and actually try and come up, you know, with an action plan and monitor that action plan.
Education, water, health. Each area has unique corruption risks and unique problems, ranging from absenteeism to opaque decision-making. But the solutions are strikingly similar: participation, greater transparency, and accountability. In Senegal, the process has just begun.
Inspecteur travail dañu war dem inspecter jël ndox mi yóbbu ko ñu xool ko ndax nit ñi war nañ ko naan est-ce que ñun xam nañ loolu ñi ngi koy def defuñu ko c'est pas wóoruñu dañu naan rek.
Dans ces zones où l'accès à l'eau est difficile, il y a également beaucoup de problèmes, des problèmes de gestion, surtout de gouvernance des systèmes.
ba tey comité mi ngi fi comité bi nag gëj nañoo réunion yu bokk la yëguma ko comité bi gëj nañoo réunion gëj nañu woote réunion ci robinet yi wante comité bi am na moom mi ngi fi.
Ceci nécessite véritablement des éclaircies, donc des réunions pour qu'on puisse savoir exactement ce qui se passe dans la gestion de ces bonnes fontaines.
In many communities where Transparency International is active, things are starting to move. Back in Mombasa, Saiton has also decided to take part in a light-hearted meeting of reconciliation. The soccer match was organized with the help of Transparency International. After years of distrust and mutual accusations, representatives from consumer organizations and the water company have come together in a spirit of friendship.
Through football, some sort of teamwork is built, some synergy that comes up, and at the end of the day, the user doesn't view the water service provider as an enemy. Instead, he views the water service provider as a partner.
Transparency International's initiative is bearing fruit in many communities. Providers and users have joined forces to improve service delivery, and that is what it's all about.
We are facilitators. We're here to facilitate. We're here to give you the tools. We're here to give you the methods, you know, in terms of how to engage, how to increase, especially issues of integrity.
Functioning basic services are vital for improved livelihoods and quality of life. Participation, greater transparency, and accountability will go a long way towards getting them to work. Transparency International has pushed for these reforms in countries across Africa. But ultimately, it's up to governments, providers, and users to implement them. If they do, reliable health, water, and education services will become a reality for communities across the continent.